Hey gang, sorry we couldn't finish class today, but finishing class. So I think I have a little bit better idea about how to manage my time a little bit better. So I'll try in the future not to have to make videos. So we were talking about injections. We talked about using a hypodermic needle, what hypodermic meant, and we talked about the parts of the syringe. We talked about slip tip, lure lock, how to tell the difference between a 100 unit. This should say insulin, so please write that in on your own. Insulin syringe versus a TB syringe. We talked about the bevels on the needles. Basically, our nice 45 standard bevel is going to give us a nice fine point. That was the biggest thing to remember there. The biggest thing to remember from this slide was that the higher the gauge, or the bigger the number of the gauge, that means the smaller the actual needle tip. It's the best way to remember it. And then we were on this slide before we had to end class. So this thing over here on the right hand side is a good just future reference, but for now what I want you to remember is the which size for what. So so this means that we want to use a 25 to 27 gauge, so a very tiny fine syringe for doing an intradermal injection with a needle side length of a ½ inch to just over a ½ inch long. If we're doing a sub-Q injection and we're going into the subcutaneous tissue, then we want to give that injection with, again, a 25 to 27 gauge needle, very tiny, and again, a very small or short needle length. And then the IM injection, that's going to go into the muscle layer. We need a nice bit longer one to get all the way through the skin down into the muscle. And then we, as you can see, we give a bit bigger gauge. Also, just so you're aware, there are different types of needles, and this is why you have to know that you're using a hypodermic needle whenever you're giving an injection. Well, how do I know the difference? You gotta read it. Just read what it says on it. It should say hypodermic needle for injection or something like that on it. If it's a filter needle, a dialysis fistula needle, a Huber needle, a spinal needle, biopsy needle, any of those, that's not what you're going to use for an injection, okay? So you must make sure if you're giving an injection, very important, this might be on the quiz, hypodermic needle. You need a hypodermic needle. So what do you use a filter needle for? Well, you're going to learn tomorrow that when you open an ampule is a little glass, looks like a little glass blown thing that has medication in it. Well, when you break off the top, you're at risk of getting glass inside of the actual medication. So you use a filter needle. It has a small micron filter inside of it. So when you draw up the medication into your syringe, it won't get any glass particles in it. Okay, so that's what that's about. This is for you to watch. This is the one-handed scoop technique, or the one-handed recap, one-handed needle recap. So basically, you're not going to pick up, and you're going to practice this tomorrow, you're not going to pick up the cap and shove it on top of the needle, because again, that puts you at risk from needle sticks. So it's recommended highly that you try not to recap as much as possible. You just switch out needles, or you use a safety needle and then switch out to a new needle. But if for any reason you do have to recap your needle, this is how you would do it. And so watch that video. You put the cap down, you use one hand, and you carefully and slowly stick the needle into it, scooping up the cap, so you don't scoop until you've got the needle way up in there. And then you can either push the end against something to close it, or you can pick it up with the cap on and just push the cap down. Now, biggest thing I want to focus on is intradermal injections. Here's our low down, because you go low. So I want you to remember intradermal injections, we're doing the low down because you go at a low angle to give these, okay? So this is what we're going to be practicing and what you'll be checking off on next week. So you'll be checking off on, specifically because it's most often used for a PPD, the something protein derivative. My goodness, I completely blanked. But basically your TB skin test. That's where you most often give an intradermal injection. That's what you're going to do for checkoffs next week. You're going to give somebody their TB skin test. You're going to perform this on, not on a live person, but you're going to go through all the checks. So you're going to have to do your 6 medication checks. You're going to have to look at their MAR and see what's ordered. You're going to have to look up the med. I would recommend looking it up before you come to class. on Tuesday before you come to checkoffs. So you're going to look up the medication, the TB, and make sure that the patient doesn't have any allergies to the PPD or the TB skin test. And then you're going to go ahead and perform the injection using your 6 rights and 3 checks. So where do we give this? Well, we perform it on the inner aspect of the forearm, usually the top 1/3 of the forearm. So the forearm is the area, remember, from our wrist to our AC or antecubital fossa. And the reason that we perform it there is because we need it to be on a nice surface that's uninterrupted by hair, moles, rashes, or scars. Our goal here is not to penetrate the subcutaneous layer of the skin. So there's a little reminder of our skin layers. We have our epidermis, our dermis, and our subcutaneous layer down here. So we want this to go whoop right in there between the layers of the epidermis and the dermis. Whew, that's hard because this is really thin, you know. So how do we do this? Or what's our goal here? We want to form what's called a wheal. So a wheal, as you can see, is this little tiny little, or bleb. It's also referred to as a bleb or a wheal. We want to get this little tiny thing where it's popping up, and we can see the injection that we're giving underneath the skin. We don't want any bleeding because remember the capillary beds are down here and inside of this area of the skin. So we don't want to get too low. If there's any bleeding, that means we went too low in there. And we want to form the wheal. So remember that, you know, for a quiz or something. If it says, if I ask you what our goal of an intradermal injection are, or if I ask you what if you see bleeding or you don't see a wheal while performing an intradermal, what does that mean? And that means that you went too deep and the injection will have to be repeated. So how are we going to perform this? Well, again, you do your 6 rights, your 3 checks, and this is all in your checklist book. You draw up your medication into an appropriate size syringe and use an appropriate size needle. Well, remember, we already said that TB injections have a special size syringe. That's way up here. So you get your 1 ml TB syringe, so make sure you look at that. If you don't know which one it is, have somebody help you tomorrow in class there. See, we don't want to go down and get into this and any blood stuff here. So we're just going to do our 6 rights, 3 checks, drop our medication into our syringe. We're going to locate our area, which we know is going to be on the forearm, on the inner aspect of the forearm. We want to clean the area using an alcohol prep pad, and then we'll allow that to dry. You'll position your needle at 15 degrees. So let's go back up to this slide 19, and you see how this, we're going really almost parallel here with the skin, but we're up just 15 degrees. So where we position our needle, and then we want the bevel up. So do you see how this part of the needle, the bevel, is facing upwards, away from the skin, away from the body. So the bevel needs to be up because we want this to go whoosh up like that. So 15 degrees, again, this would make another great quiz question. What does our needle position need to be? It's 15 degrees, bevel facing up. You gently insert the needle into the dermis, about 1/8 of an inch, and you should be able to see the needle under the skin. And you'll look for a wheal or the bleb as you start the injection. So you'll just give like a tiny little bit and see if it starts forming a wheal. If not, then you need to draw back a little bit. Okay, so you should be able to see the needle under the skin. You should look for the wheal. You'd administer the medication, and then you withdraw the needle at the same angle as you inserted it, which is 15 degrees in this case. And then you'll apply a gauze pad with tape over top of it, or a Band-Aid. You do not massage the TB skin test. We do not want it to go out into the skin. We want to be able to see this wheal, okay? And then when we're done, we document. So you always document your insertion site and your laterality, so inner aspect of the forearm, on which arm, right or left. Was there a wheal? How did the patient tolerate it? Good, fair, poor is usually our patient tolerance. Which medication did you actually give? And the route, which, you know, intradermal, we're going to document our route. We gave that medication, we give it intradermal. The medication lot number, whenever you give any kind of vaccine or like the TB skin test, they'll always have a lot number. So we'll document that, and the time and date of injection. So that's how you're going to perform your intradermal injection for your checkup, okay? And that's in your checklist as well. Okay, last but not least, for just stuff to look at really quick here. So I'm going to close week 1. Done. Bam. We did week 2. Bam. Okay, so for tomorrow, before tomorrow, upload your ATI ticket into here. Before tomorrow, check this out. This is your ATI assignment. These are your readings that you need to do today, or if you've done them already, good job. These are all the things that I want you to cover in your lab tomorrow. And you should be practicing for checkoffs, the administering intradermal injections, and their 6 rates of medication administration. Now, there's not exactly a checklist for that, or there is kind of a checklist for that, but I just want you to get used to practicing that while you're practicing giving the injection. And then for checklists, so what you're going to do next week is you're going to need your 2.16, your 2.11, and your 2.30 checklists, okay, for checkoffs on Monday. Again, you need your removing vial med, preparing and administering meds, and you're administering intradermal injection, okay? The rest of them are just there for you to look at and to do for your peer checkoffs, okay? For this week, you should have all, if you got checked off on your assessment, you need to upload it here, okay? So it looks like I already got a couple submissions. That's great, but I need to see that your checklist submitted here, okay? And I just gave you a couple days because I know Mondays and Tuesdays are busy, so I gave you until the end of the day on Wednesdays to get those submitted. Okay, if you have any questions, let me know. There are some stuff. One more thing I want to make sure I cover here. No, not this. Sorry. Schedule overview. Some of these say in our schedule overview, if it's in Canvas modules here, that's just going to be found in the PowerPoint or in these readings. There may not be an actual checklist for it. So the best thing to pay attention to is your master skills checklist, because you'll see on here, it just says drawing up meds from ampules and your glucose finger stick here. So pay attention to this one. This is the one that you need to do your peer checkoffs on. So don't be overwhelmed by the checklist or by that schedule overview. The schedule overview is what we're going to practice in lab. And some of it are skills to help you perform these skills that you're going to be checked off on. Okay, such as 6 rates of medication administration. So don't worry too much about that. Go by your master checklist, okay? All right, hope that helps, guys. And I'll see you again tomorrow.